Three.
Hi, my name is Lindsay. I'm going to be giving my patient Jennifer Ng her secondary fluid, which will be antibiotics because she does have an infection. I would pre-assess her white blood cells, temperature, or any other local signs of infection that she may have. I would also come to the room, hand hygiene, assess for any allergies to Cipro or anything in the Cipro family. I would also assess her IV site, but before I would do that, of course, I would use 2 patient identifiers, and everything is good. She is not allergic to Cipro or anything in the Cipro family, and I would then make my way to the Pyxis to retrieve my medication. From there, I would do my first and second checks, get my medication out of the Pyxis. I would check for compatibility with my primary IV fluid, which is normal saline, and it is compatible. I would also check for expiration or any sedimentation. From there, I would make my way back to the patient's room. I'd perform hand hygiene. I would do 2 patient identifiers. I would also do my third check of the medication at the bedside. It is what I'm supposed to have and the correct rate and dose. And then I'm going to set up my bag. Before I do anything, I'm just going to lower this so I don't forget. Whoops. All right. Okay. So now I'm going to prime my tubing. First thing I'm gonna do is make sure that it's clamped when I take it out of its packaging. And then I'm going to spike the bag, being sure to only touch these 2 ends together and nothing else. I'll then invert, squeeze my chamber. Perfect. Now I'm going to hang my bag. No, I'm not. I'm going to prime my bag. This is very loved tubing. I would be sure to prime before I do anything. All right. Now I'm going to leave this. This doesn't have a cap on it. I would scrub vigorously for 15 seconds. Typically this would have a cap on it, but again, it's been used. So just to be on the safe side, we're gonna scrub it. Okay. Now we're going to connect. Pause, connect, unclamp our tubing. Now we're going to set up our secondary tubing. So we're gonna go ahead and channel select one more time to secondary tubing. I'm going to grab my MAR for clarification. We're going to find our medication, which is ciprofloxacin. Make sure it's the correct dosage. It is 200 milligrams over 100 milliliters. A double check, yes. We're going to next. I'm going to start. I'm going to wait for my first drop. I've seen my first drop. Now I'm going to label my bag, which is name, date, initials, date, and time. I'm going to label my tubing, initials, date, and time. The tubing is good for 96 hours. I'm also going to educate my patient on signs and symptoms of potential side effects with this medication, which could be anything like GI upset, like diarrhea, potential kidney stones, so painful urination, or tendon pain. I'm also going to do hand hygiene and document.